Coming up today, she never missed a mammogram, and thank goodness she didn't, because she found her cancer early and finally found the cancer team she needed. Good morning, I'm Alexis Del Cid in for Jessica Lovell. Welcome to the Morning Medical Update. We're going to meet our special guests in just a moment, but first we have our morning rounds. And our morning rounds are very topical because voting is underway for several hotly contested issues, including the next president of the United States. No matter the topic or the candidate, all of us have to return to our homes and our families tonight and our friends that we've had forever that might be voting differently and figure out how to navigate and where the votes landed. In fact, some social media reports indicate this divisiveness is splitting some families apart, literally. I saw a tweet the other day about a woman who's getting divorced from her husband. The final straw was the presidential election. It's so sad. Anxieties are running high for so many people. How do we cope with this? Joining us for advice is Dr. Greg Nawalnik, a psychologist here at the University of Kansas Health System Strawberry Hill campus. Dr. Nawalnik, we're so glad you're here. Back in May, a survey by the American Psychiatric Association showed 73% of adults were anxious about the presidential election. A lot has changed since May. I don't think the anxiety has gotten any lower. What's your take on that? What do you think the number is?
Well, so the APA, the American Psychological Association, just did an updated one that was released in October. And it shows that, yeah, it's gone up. Not surprising if there's something that somebody's anxious about. As it gets closer, anxiety is going to tend to go up. What I would say, though, is, you know, these surveys, statistics, data, I wouldn't look to those to tell you how you feel. Maybe just to normalize it, that's fine. But if you were anxious about this before, you're probably anxious about it now. And if you weren't too concerned before, however that happens, you're probably not too concerned now. So I think it's more important that we just center in ourselves and what we're actually feeling and going through.
Some studies show that being addicted to news is linked to poor mental and physical health. What's your take on that, Dr. Nawalnik?
I mean,
I don't feel better after watching 24-hour news.
No, and I think, you know, we've had a major transition in how we consume and digest information. And it used to be, you could avoid this stuff pretty easily if you wanted to. You get your morning paper in the morning, evening news at night, and that was pretty much it. So pretty well regulated, not too overwhelming. But now in this 24-hour news cycle, you know, and there's a lot of stuff that's just opinions, people talking, but people are looking for anything, because when we get scared, when we get sad, when we get worried, our brains kind of lead us to like a moth to the flame. And so we have to understand the influence of social media around this and know how social media works. It wants to keep us clicking. That's how it monetizes our viewership. So you know, we have to expect that the things that we're seeing on social media are going to be triggering, are going to be alarming, and maybe aren't completely factual all the time. Yeah.
I was going to say, have you heard the term doom scrolling? Because I got caught up in that, where for some reason I'll scroll and it feels weirdly, I don't like the feeling, but I can't stop looking at divisive or upsetting things on my Twitter feed, and then the more I click on them, the more I see of that, and then I think that more of that is happening in the world. But then I step outside and it's not happening outside my front door.
Yeah, welcome to the algorithm. That's where your device senses what you're doing and then gives you more of it. It's kind of what's caused this election to be so incredibly divisive, is where we have people that are in these echo chambers where social media, maybe their friends, are just solely giving them the same information over and over that confirms what they feel. And so what that creates is a situation where an individual that likes one side can't imagine how anybody could like the other side, because they just keep seeing hate about that side and then supportive comments and information about their side. And so it really does, drive a wedge in that rift.
So how do we navigate this with our kids? We have parents with littles at home. We have parents with teenagers. I'm sure there are different ways to talk about each age group. I'm still trying to figure out how to talk to my teenager about half of this stuff.
I mean, it's important to try to keep it age appropriate. Like, you're not going to get into deep political issues with a toddler or elementary school kid. Let your kids kind of lead the conversation. Ask, what do they know about the candidates? What do they know about government and what's actually going on here? And start from a place of what do they know? What do they want to know? And then try to address it from there in a way that serves to inform rather than scare or anger. Let's just try to help them understand the process is probably the most important for younger kids. And then for older kids, based on their level of exposure and understanding, you can take it a little further in depth.
Do you have any self-care advice for my mom? Who's watching political news nonstop? I mean, she's like so many people, but everyone's talking about how their parents are just glued to the TV. Can we tell them to turn off the TV and just hang out with their friends? And how do we do that?
I think that's kind of a good argument. It's just to explain, like, hey, you can ask them how to kind of use some Socratic questioning here, play Columbo. Mom, I notice you spend a lot of time on an iPad thing, and when when you come off of it, you don't seem happier.
Right.
This is how do you feel after you use it, and just kind of do some insight-oriented questioning, and then maybe help them recognize at the end of the day, there's only one thing that we can do about this, and that's vote. And as long as you're going to vote the way that you want to vote, there's this, I think the major source of the divide is when our vote and our belief isn't enough, we need to convince everybody else that it's right and that it's the one and only way. And so the more that we approach it in that way, we're going to be anxious and we're going to be upset and we're going to get mad. And so we have to recognize the importance of doing all that we can. And if you feel your vote isn't enough and you do want to do some things like canvass, work phone banks, it's over now, but you should have been doing that, and that would give you a sense of agency rather than doom scrolling where you're just getting information that it kind of creates this really intense agitation and discomfort.
Yeah, the doom scrolling, that's the pits. Yeah. Dr. Nawalnik, thank you so much for joining us and helping us keep it together for this election cycle. And we've got a lot more election cycles ahead of us, so we got to figure out a way to navigate these times. Thank you.
Thank you.
And now to our health topic. And by the way, don't turn us off. When we say turn the TV off, hey, we're not talking elections, we're talking mental health, how to cope, important health information, and we have some really incredible guests with us this morning. Kerrie Mooneyham has always taken her health seriously, especially after watching her mom go through breast cancer. She knows the importance of screenings and a second opinion. Jessica Lovell shares her story with us.
Kerrie Mooneyham is a 58-year-old mom of 3 and Mimi of 4. She takes her health very seriously. Her mom was diagnosed with breast cancer.
I do it every year. I never miss a day. I'm never a day late.
Her mammogram this time was different.
They said they could get me in the next day for additional imaging.
Kerrie wasn't in full panic mode yet. She knew she had dense breasts, which can create a false negative. But then the technician performing the additional testing abruptly delivered the news.
I said, "What do you think?" And just very nonchalant, "Oh, I'm 85% sure you have cancer."
It was a bomb drop.
And I said, "What?" And she goes, "Yeah, I'm 85% sure that you have it." And I could just feel the blood rush through my body. She had no empathy for me whatsoever.
The conversation left Kerrie feeling unsure about her care and treatment options at that hospital. Her thoughts immediately turned to her family.
I'm telling you, it's the darkest place I've been, probably in my life. My kids are very strong, but when you see your grown kids crying, it's hard. It's hard.
Kerrie wanted a second opinion.
Hello.
When she got in front of breast medical oncologist Dr. Ann O'Day at the University of Kansas Cancer Center, she felt immediately that she was in the right place.
Oh my gosh. This is how she sat with me. You have this, and she
held your hands.
I think she did.
She did.
You have this, and I want you to know it's the most beatable and it's the most treatable, and you're going to be okay.
While the diagnosis was confirmed, triple positive breast cancer, "You're going to be okay," is all Kerrie and her husband Scott needed to hear.
I needed somebody to confirm that I was going to live. I've got too much to live for.
Treatment would, however, include 6 rounds of chemotherapy.
And then I'm ringing that bell, and it's going to be the best day, and all my kids are coming. It's going to be 2 seconds, but they're coming to watch me ring the bell because we're celebrating.
Later, she will need to undergo a mastectomy and will need cancer surveillance and a hormone blocker. For now, she stays focused on the good stuff.
My relationship with Scott, so much stronger. I mean, we've been together for 40 years, but so much stronger. He's been such a rock.
She's also solid in her faith.
Super proud of you.
Thank you so much.
And thankful for the new her cancer has helped create.
I'm happier now than I've ever been. Happier. Am I glad I have cancer? No, but I'm happy how I've changed, and I'm happy the person that I've become through it all. You know, God's molded me and changed me into just the best version of Kerrie.
Kerrie Mooneyham and her husband Scott are here. I hear sniffling and I'm sniffling.
Sorry.
And so we're going to share these tissues. Thank you so much for being here. I got to ask, you've been together 40 years. Did you get married when you were 10?
No, we did
When
not.
did you start dating?
1985. We met at Missouri State.
Oh my gosh, that's wonderful.
Yeah.
Well, we'll get to your story in a bit. And we also are thrilled to have Dr. Ann O'Day here. Dr. O'Day is the medical oncologist who stepped in and really took the reins and gave you something that you desperately needed, which was hope. And a plan. Dr. O'Day, thank you so much for being here. What an incredible testimony to your care. Kerrie, I can't imagine the experience you had with the other place,
Right.
where they just dropped this big bomb in your lap.
They sure did. That's what I described it as, an atomic bomb.
In your lap.
Yes.
And
With no explanation.
Right, no bedside manner,
No.
no compassion.
No.
You're in the midst of chemotherapy now.
Yes.
How many sessions have you completed?
I've completed 4. I have 2 left.
How are you feeling this morning?
I'm good. I'm coming off my treatment. I have treatments every Wednesday because they know that by the weekend I'm going to be feeling different.
Yeah.
Start feeling side effects, and so it's usually, by Saturday and Sunday I'm feeling very tired, and then usually Monday and Tuesday I have weird side effects, like my ears are popped, and I have some breakouts on my skin, and just I don't feel myself. And so, but now I'm on at Tuesday now, so I'm starting to do the climb back uphill. So
It's a cycle. It
It
goes
is.
up and down.
Yes.
And Scott, this is your girl. This is your college
It is.
sweetheart.
yeah.
I've been so impressed through this whole experience. She just came out of a shell. I mean, I'm so proud of her. She's taken it one day at a time, and she's always been this way as far as whenever she's sick, nobody knows it mentality, and she's a trooper. I call her a brave trooper, and she never lets a day get her down. I'm just proud of her.
That's beautiful to hear. What's it like to have your rock next to you?
I couldn't do it without him.
Couldn't do it without
Yeah.
him. I want to weave Dr. O'Day in here as well when we talk about the diagnosis. It started with your regular mammogram, which is amazing. You stayed up to date
Oh, yes.
on those because you knew the importance of
Yes.
that. You got your results elsewhere, and abruptly were told that horrible news. As we mentioned, this process started at a different hospital, but you wanted a second opinion, which is how you met Dr. O'Day. Can you describe your experience in more detail of seeing Dr. O'Day walk into the room? And I love the visual of her just sitting there, and she was in it for the long haul.
She was. Scott had brought his dad to KU. He battled sarcoidosis a few years ago, and so he'd brought him to KU for the second opinion, and because of the wonderful care that KU provides. And so after I received the news, we didn't like what route they were going because, like I had said, my mom battled with breast cancer, and I thought it was going to be a lumpectomy. I thought I was going to have radiation for a few years. I thought it was going to be wham, bam, thank you, ma'am, you're good to go. And instead, when I walked in, they were saying chemotherapy, you have a very aggressive, because I have the HER2 receptor, so you're going to need it like hardcore, maybe a lumpectomy, but probably a mastectomy. So everything I did not want to hear, they were telling me with no,
compassion or anything.
Yeah, no warning, and then no what the plan is, and am I going to live or die? Oh. And so leaving that appointment, it was horrible. It was devastating. And then Scott having to call our kids. I remember one of our sons was at the movies with his 2 young sons, and they left the movies and they rushed right over. And so I've got all my kids coming over, and I knew that it was bad. Yeah. And it was very hard. And so I knew I wanted a second opinion. And so we called KU, and the nurse navigator was amazing.
Oh, they're incredible. These nurse navigators are unbelievable.
Unbelievable. And they were scheduling things out. Okay, well, we'll do this in in a few weeks, and we'll do this in whatever down the road. And I'm thinking, I've got the HER2, and it's supposedly dividing, and it's aggressive, and you're telling me it's going to be, 3 weeks down the road, and I'm like, I'm not waiting. I don't know what's happening. And so,
what
anyway,
about when we first walked in?
I'm going to say that, but what I want to say is she got me in within a few days.
It was perfect.
Yes, and so when he drove me up to KU, I think it was the Westwood campus.
No, it was in Overland Park.
Overland Park, okay. Yeah. Anyway, I walk in, and this just immediate sense of peace as soon as I walked in the doors. And he's like, welcome to KU, is what Scott said. And everybody's there's hundreds of people running around and doing their job, but they literally act like you are their only patient. I felt like I was their only patient. And the sense of peace I had with Scott by my side and my family and where I work, but KU, and then of course I'm very strong in my faith. I just had this immediate sense of peace. And then when I met Dr. O'Day, and she got right in my face, and she was telling me there's this kind and there's this kind, and we're not even going to talk about this because this is not what you have. This is what you have, and it's the most beatable and it's the most treatable, and you're going to live a long, healthy life. And just to hear those confirming words, that's all I needed.
Right.
And I wasn't receiving that from where I was going.
Thank goodness that you got in to see Dr. O'Day and our team here.
Yes.
Dr. O'Day, hearing Kerrie and Scott talk about their experience, when you walked into that room, did you know they'd had such a horrendous experience elsewhere, and you were walking into a woman who was severely traumatized with her husband by her side?
Right. Yeah. No, and that's the thing. We never have any idea really where our patients are meeting us. And we always say, we are meeting our patients often on one of the worst days of their life. Like that's where we live and that's where we operate. So we kind of have that expectation. But some patients are coming in with a wealth of information. Other patients are like, this is the first time I'm hearing this. So we try our best, to meet them where they are. But oftentimes, not having that background and not knowing that can be really difficult. I think, one of the things you all were talking about, the nurse navigators, and I always just want to reassure patients. I sometimes don't think that patients, when you call that number and you get that nurse navigator and they tell you, their role and what they're going to do and assimilate your records and get you to the right doctor. I think what a lot of people don't realize is that behind the scenes, they're reaching out to us as the physician immediately. And they are trained in their type of breast cancer. So our breast cancer nurse navigators are only nurse navigators for breast cancer. That's all they do. So they have a lot of medical knowledge pertaining to different types of breast cancer, to what types of treatments might be needed. And so as soon as they see a patient records and talk to a patient like Kerrie, as soon as they see HER2 positive, that immediately goes to the medical oncologist. And I remember getting an email about Kerrie saying, your next opening is like 2 weeks or whatever. And we said, well, we'll find a way to work her in sooner because we understand that type of breast cancer is going to be something that we need to get started on sooner rather than later. So I just want all patients to be reassured that we're not going to let them kind of flail in the system, if you will. The nurse navigators are advocating for them behind the scenes. They're reaching out to us. So if we see that it's a more aggressive type of cancer, we're going to prioritize that. We're going to find a way to make that happen for that patient. So I never want them to think, now the reverse is also true. If we see a patient where we've reviewed all the records and we see this is a cancer that's likely been present for years, and so it might take us 8 days or 10 days to see that patient, but we only do that understanding that we have reviewed the records and that we feel very confident that that's what's safe and best for that patient. So I know, like Kerrie said, you get nervous that you hear things are weeks down the road, but understand that we are always going to be advocating for that patient and what they need and what's going to be best for their type of cancer.
Oh, completely. You just sparked something that's personally happening to one of my best friends. She got horrible treatment somewhere else, referred her here. She thought she was going to have to wait. The other place said 3 months. I said, just call the health system. They'll figure it. Call the cancer center. She was in for her treatment within 6 days, and she said, "What's a nurse navigator?" I said, "Don't worry. I don't even know how to explain it. They're superheroes. They'll get it done. Yes. You can clear your mind of all the administrative things of scheduling and keeping files. They'll figure it out." And
I had, within that week,
it's incredible.
The schedule for Dr. O'Day, the surgeon, the social worker, the pharmacist. I mean, they had everything all scheduled out. I didn't even have to think about it.
And you shouldn't have to. You should be able to focus on your healing and just keeping it together.
Right.
When it comes to the actual diagnosis, Dr. O'Day, can you explain to our viewers HER2 positive and what that diagnosis means for the treatment plan?
Sure. And we understand that in Kerrie's case, and I'm so glad you're getting to meet her this morning because she and her husband are amazing people, and they're just so, they're a gift to me, really, and to all of our staff. And we've been so privileged to be able to work with them and get to know them and some of their friends and family. And, HER2 positive is a particular subset of breast cancer. It's about 15 to 18% of all breast cancers. And it used to be considered, one of the worst types of breast cancer, because we do know that the cells are more rapidly growing. They have the potential to spread in the body a little bit earlier on. And so we now understand, though, that we have very targeted treatments that are given, which use that receptor to work against the cancer, to effectively put the brake on the growth of those cancer cells. Now, prior to the early 2000s, when we had these medications approved, again, this was considered a bad type of breast cancer. But now, as you heard Kerrie articulate, one of the things we said to her is this is the most treatable form of breast cancer. We have the most knowledge and comprehensive understanding about the cell signaling pathways that are active in this type of cancer. And so the more we understand about it, the better, that we can design a treatment plan. We have very targeted treatments that we're using to work for Kerrie, and we'll assess, how well that works when we get the results of all of her pathology, and then we'll design treatments for after that. And we have lots of options with newer targeted therapies. We currently have a very important clinical trial that is looking at this type of breast cancer and a newer treatment, which may improve things even further. So there are so many exciting advancements in this particular type of breast cancer. I personally believe that this will be the first type of breast cancer that we can say is truly cured. I believe that all patients that walk through the door eventually, will be able to say that cancer will be cured. We're going to get there. I'm confident in hopefully my lifetime as a breast oncologist. But I am very optimistic about her treatment. And then, of course, you see the attitude and the faith that Kerrie brings to this. And it's just so important because no matter what we throw at her, she just keeps on putting one foot in front of the other, which is really the most important thing. And that's what we really ask of all of our patients in this situation. I always say, you're doing the hard work. I'm just here sort of guiding you, but but you're the one that's really doing the hard work. And she's absolutely doing it with amazing grace and such an inspiration to, I know, all the people in her life.
Dr. O'Day, there are families watching this program and women who have just got a cancer diagnosis who are going to hear your words and feel such a sense of relief, like they can breathe again. It's just so beautiful to hear how you articulate and talk about what you know and what you're going to do. No wonder Kerrie and Scott felt so much better.
Yes.
After Dr. O'Day walked into the room. Be sure to ask your questions to us. For our viewers joining the chat right now, you can join the conversation on YouTube, Facebook. You can email the Medical News Network. The information on how to connect with us in real time is right there on your screen. So Kerrie, about the chemo, once the chemo is over, your surgery is next.
Yes.
Do you need to have a mastectomy?
Yes, that's what we discussed, and they said just a single mastectomy, but just a few weeks ago, I just felt this, you know, felt like God was saying that to me that I should probably do a double. Not that I think that it's, Dr. O'Day said it doesn't spread from one breast to another, but you know, I just never want the chance, or I never want it to come back.
Right.
Not that it's going to, and I don't want to have those doubts in my head, but they've served their purpose. I've got 3 kids. I nursed them all. I'm good, and so I think in my mind, I just felt peace about doing a double mastectomy. That way, they don't have to match them up and just take them, and I'm good.
Get it done.
Get it done. So I think I'm going to do it. I think I'm going to do a double, which is going to be some healing and things like that. But I have an incredible workplace that's very supportive. They're like my second family.
Oh,
so
that's great.
Yeah.
And you have a beautiful family.
Thank
you talk
you.
about your kids coming home and your husband very excited. You call in the cavalry. And they show up.
And they showed up. And you expect that from a close family, and I expected that from them, and my parents and all of my friends. And I mean, I was at a point where my daughter Katie was my secretary because my phone was blowing up, and I could not. Before I was but before I was at KU, my phone was blowing up when people were getting the news, and I was like, I couldn't talk about it, I couldn't think about it. And then after I was at KU, I mean, I'm thrown out first pitches at the softball game for Blue Springs High School. Yeah, there they are.
We're showing a slideshow of some of the pictures you shared.
I'm on a morning show for KU. I'm doing the Bravest Shave at the high school. They've done fundraisers for me. So for somebody that wanted to keep it low key and not know anything, it's just kind of
good luck.
It's kind of blown up. But the community's been amazing. There's been some benefit walks.
Kerrie, I don't have my glasses on. What do the shirts say?
It says I wear pink for, and Scott says my wife. My kids say for my mom. My kids say for Mimi.
Is that what your
for my sister?
Call you?
Yeah,
Mimi?
grandkids. And then that's my coworkers, which I love, and they're amazing. They're said for my friend, and then I had all of the titles on my shirt. So I'm Mimi, mom, daughter, and that's at Mindy Bishop. She hosts the Stephanie Vest walk in Blue Springs every year. So on my mom's birthday, we're walking in the Stephanie Vest cancer walk. And so we all have our shirts on, and on the back it says Mooneyham Strong.
Oh, that's so beautiful, and that support team is amazing.
It is.
Can I ask Scott you about your faith and how your faith has helped guide you and Kerrie? She mentioned it as well, and she has a beautiful
absolutely.
necklace on.
We're just so thankful for our faith. Thankful to our parents for bringing us up with faith, and knowing that whenever we face trials and tribulations in our life, we're not alone. And so through our faith and through our family support, we can handle anything.
Yeah.
And no matter what the diagnosis is, but we're thankful for the diagnosis that Kerrie has, and we're here to support her every step of the way.
We have some questions coming in and some comments from our viewers, and I want to get to one right out of the gate from Jill. Jill writes, beside the bedside manner, what was the difference in medicine between the cancer diagnosis at the other hospital and the cancer diagnosis at the health system?
I don't know if it was necessarily the diagnosis. I think the diagnosis was the same, but they didn't really have a plan.
Yeah, they were kind of on the fence.
And
They
that's
really
what she
weren't
said.
sure
I kept
how to
looking
attack it.
at the surgeon, and I'm like, I'm trying to read the room, and I'm trying to understand just her body language. And I said, what are you thinking? Because I need to know. And she's like, I'm kind of on the fence.
Oh gosh, that's not what you want to hear.
That's
On the
when we
fence.
said we were going to get a second opinion. And she
Right.
was like, oh, I'm so glad to hear that.
She said that?
Yeah, she said that.
Wow.
She said, I think the second opinions are important.
Certainly nobody there told you it's treatable and beatable.
No, they didn't.
Wow.
They didn't even say I was going to live through it.
Oh my goodness.
Yeah.
Stuart has a great question. Stuart writes, words matter, and I hear a lot of people use the words cancer battle or fighting cancer. How does Kerrie feel about that metaphor? Does she still feel like she's in a fight or a battle?
This sounds really weird for me to say, but through all of this, I don't feel like I'm in a battle, and I don't feel like I'm struggling. I feel the happiest I've ever been. And I don't know if anybody really, honestly, can truly believe that, but as a person and, you know, a daughter of God, and with my family and the support from where I work at Blue Springs High School, everything is in perspective now. Everything is in perspective. Things don't bother me like they bothered me before. I mean, who cares if the carpet needs to be swept? Scott will sweep it later. or you know, and I would say the hardest thing for me right now is that I can't taste, and what I can taste tastes terrible. And so I've lost some weight, but hey, that's not a bad thing either. But I can truly say through all of this is I'm the happiest I've ever been. And I said in my interview, you know, with Jessica, that I feel like I'm the best version of Kerrie, and that's what I feel like I'm becoming. I feel like I'm being molded, and God is saying, you know, this is how you need to be, and I'm responding, and I'm accepting of that. And I remember I just had a granddaughter, my first granddaughter born about a month ago on September 17th. Thank you very much. I've got 3 awesome grandsons, and now I have a granddaughter, and her name is Lainey Wren. And my daughter-in-law Kaylee was like, I don't want you to think back on when I'm pregnant, when she's born, as this as being the dark period of your life. And when she was born, and her name means shining light, and that's what she's been. And I have so much to live for, and I'm just so happy, and I'm so thankful that she was born during this time, because it's just a constant reminder of how good God is and how wonderful my family is. And
That's
yeah,
beautiful.
yeah, thank you.
Beautiful.
Thank you.
Scott, would you like to add?
How can I add
How do you
to
follow
that?
up to that? Yeah.
I mean, I think the key in any type of diagnosis is your attitude.
Yes.
And that's been a key for Kerrie. And I think it comes from a combination of things. Obviously, our faith is foremost where we draw our strength from, but our family, the friends, her community, who she works with, it's been overwhelming. She had students that were driving back from college that she had in high school when they heard she was going to throw out the first pitch. So they just drove back for that and then drive right back to school. It's like the outpouring of support is so, I feel, critical when somebody's going through a diagnosis like this. And so when you experience that, how can you not feel good? And that's what we're seeing here in Kerrie.
The whole football team, I don't know if you know anything about Blue Springs football, but it's a big deal.
I know it's a big deal.
It's a big deal, and the coach led the team up to the softball field, and they lined the softball field in the outfield while I threw out the first pitch. And then the stands are full of my friends and family, and all of their shirts that say, "I wear pink for my friend," or "my mom," or whatever. And it was all that. It was. I said it's one of the top 10 best days of my life. I mean, of course, marriage and having kids and grandkids and things like that. And then that was one of the top 10 moments of my life for sure. And I feel like the medicine and the treatment and the doctors that I work with are so important, like life-changing. But I equally think that your attitude during it all and how you carry yourself and your perspective on life is equally important.
Such a powerful message.
Thank you.
And you're leading by example, and you've walked through the fire, and you're doing it with such positivity and grace.
And I mean, usually I'm a great communicator, like one-on-one, but doing something like this big of a stage, that's not my personality.
You're pretty good.
I love to talk,
Yeah,
but
you're good.
But I wouldn't say that, but I'm so passionate about it now.
Yes.
And I remember meeting Dr. O'Day. She said, you should be a poster child for dense breast tissue, and that's what I feel like I'm doing. So sign me up. I'll go speak at a conference.
I think they're probably going to take you up on that. Dr. O'Day, as we wrap up this discussion, there's so many things to hit on: the dense breast tissue, your patient's positive attitude. Talk about a model patient and a partnership. What would you like to add?
Yeah, I mean, as I said, I'm so blessed and grateful to know Kerrie and Scott. I think, what Kerrie has articulated so beautifully about, how she feels, and she's feeling all this support, and she has her strong faith and all of these things. And this is what I have always sort of described as the gift of cancer. And it's very difficult for people, most people are not as evolved as Kerrie to be where Kerrie is now, when they are in the heat of it and they are in the, going through the worst of it, and she can't taste any food and, all of these things. It's very difficult at that point to have the perspective to be able to look at cancer as a gift. My hope and prayer for all of my patients is that eventually they get there. And the gift of cancer to me is that what we see when we work with patients like Kerrie and Scott and their families, they are such an example to us. We go home from work and we hug our children harder, and we do not sweat the small stuff. I am not sweeping my carpet. I'm like, we can use paper plates tonight, because you know what? That is not the stuff.
Yeah.
That is not the stuff that matters. And I think that really is the gift of cancer, is that we through the examples of people like Kerrie, we appreciate people so much more. We appreciate our own, loved ones and the memories that we're able to get to make with them. And, Kerrie is so, evolved and all of this, that she's able to kind of see that now. Most patients, and I want to make sure that most patients don't feel badly if they're not where Kerrie is. It's normal to go through a period of loss and grieving and anger and all of those things. And for some people, it might be a year or more after they go through the main part of their treatment before they have the perspective to look back and say, look what I did. Look how strong I am. Look at the people who cared about me. Look at the people who lifted me up. And my hope always is that all patients can get there, eventually, to where Kerrie is right now.
I'd love to talk to you, all three of you, for another hour, but I'd get in big trouble.
Yes.
Because we have to wrap up this particular program, but I want to share one final comment that just came in from our viewer, from Marcia. She writes, just dropping a note to say, same experience at KU Cancer Center. This isn't a singular experience. It is the culture and how everyone treated me. Like one person that mattered, never like a diagnosis. It's beautiful.
Yeah.
That is.
Thank you so much for joining us to share your journey, Scott and Kerrie.
Thank you for having us.
Remarkable and beautiful. And thank you so much to Dr. O'Day. Thank you for sharing your time with us today. We know you have a busy schedule with so many patients that are waiting for you, who will feel like they are your only patients.
Yes.
And
That's
thank you to
very
our
generous.
viewers. You're wonderful. We're lucky to have you. Thank you to our viewers for joining the conversation. We will see you right back here tomorrow morning.
10 years since the ALS Ice Bucket Challenge. We explore the real impacts of that viral trend. I'm Jessica Lovell on the next Open Mics with Dr. Stites. New research and novel drugs, but still no cure. Meet one woman who is not giving up, but is giving back in the face of a terminal diagnosis. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.